Hi, everybody. I'm Steve with Fitness for Five. Back here again for our weekly interview with Dr. Nario from Biointegrative Health Center. Biointegrative Health Center is in Reno, Nevada. You can check them out online and see what kind of services, treatments, and all the types of things that they offer at the clinic. So, hi, doctor.
Steve, thank you for having me. Hello, hello.
Okay, so let's talk about telomeres. Um, how how does this relate to aging and the process of aging?
Right. Well, Steve, as we all know, that this is one of the biggest things that we think about as we get in the higher age group. The thing here is when you talk about aging, so let's go back to your phrase, what is the process of aging? Maybe that's the best way to start with this. So we think always about initially about our elders. Of course, when we think about aging, well, I don't want you to be thinking about bedpans, catheters, being on a cane, and wheelchairs. So that's not really what I want you to envision. It's always like fine wine, just getting better every day, every month, or every year that passes by. Defining aging, it's always what we call the biological definition of this would be it results from the impact of accumulation of a different molecular and cellular damages that happens over time. And this leads to gradual decrease in physical and mental capacity. There's also a growing risk of disease and unfortunately death. And changes are neither linear or consistent, and they're usually loosely associated with the person's age in years. And common conditions in the older age group, people are experiencing hearing loss, cataract formation, back and neck pains, and osteoarthritis from the wear and tear of the body, diabetes, even depression and dementia. But as people age, it's really more likely to experience several more conditions all at the same time. So it's just not one thing that pops up. Unfortunately, it's like a multitude of things happening all at the same time.
Okay, so I don't know if this would be a Western medicine question, but are there anti-aging medicines?
There is. That's really, Steve, a big market right now in the field of medicine. And defining first to everybody what anti-aging medicine is, as we all know, the quest in finding the fountain of youth is one of our health goals. I mean, almost everybody. And this type of medicine refers to exclusively to slow or prevent or even reverse the aging process and to look and feel younger in some way, air quotes on that. It means that early detection, prevention, and treatment of age-related diseases are what we need to focus on. And can also focus on the external, meaning, so there are different types on when you define anti-aging. The one that we are usually familiar with would be the external type of anti-aging, meaning the skin looking younger through Botox, dermabrasion, laser skin resurfacing, dermal fillers. But the one thing I want to emphasize on is internal aging, which I think is way more important for the reason that your skin is looking good, right? But the insides are not doing well. So there goes the mileage of your machine. A good example for the internal anti-aging would be we spoke about bioidentical hormone replacement therapy. So sex hormones for male and female, testosterone, estrogen, and progesterone, comparing it to when they were younger. Even caloric restriction and fasting or intermittent fasting, and even detoxification, which are both processes involving removal of damaged cells in the body. And we also mentioned before peptide therapy. These are amino acid therapies that enhances organ function made in different forms, such as oral, ingestion, or injectable forms. And that's why this is what we do. We specialize in both, but we focus more on the internal anti-aging process. And a rising discovery right now is what we call telomerase therapy, which I will discuss. for the reason that it's the quality of aging that it helps, and it's not really going to stop the actual aging process, but it's something that will help us get to our goal in the best quality, and in terms of the organs are functioning longer and the quality of life being better for us.
Yeah, I would think that if the inside's working better and healthier, the outside would look healthier.
Ah,
I think.
not the case. I've seen that a lot. You've seen these celebrities who looks the best because of, that they are working on the external anti-aging part, but of course they pass away because of like alcohol, drugs, and other complications so that they go through. I mean, I'm not naming names, but it's just an
Yeah.
example.
But have you ever seen someone who's really, really healthy, aging really, really healthy on the inside that looks way older on the outside?
Not really. Most of the time, when you fix the inside, the outside follows. That's why I always tell patients, focus on what you're not seeing, because these are the things that are more important. We always
Mhm.
think about, oh man, I get like wrinkly skin, but you could actually nourish that wrinkly skin from underneath. If you have good collagen, if you have good supportive structures underneath, that will stretch that out and give you more protection. And the thing is, I mean, people, we are built to be superficial. I mean, I have that mistake too sometimes, but I always emphasize, and I've learned through my experience that what's inside, it counts more than what's on the outside.
Yeah, totally makes sense. So what's telomerase?
All
You
right, so
mentioned.
telomerase, yeah. So I guess I'm gonna have to put my artistry at work here. So this is what we call your chromosome, all right? This is not a four-leaf clover or a propeller. So the chromosome, as you can see, the chromosome contains your DNA. And inside, let me get a pen here. And the end of the chromosomes, as you can see here, the caps, the black caps of the chromosomes are the telomeres. So these are caps that actually protect the DNA. So the DNA is the one that's coiled up like in little like slinkies, and they protect the DNA from destruction, from what? From free radicals, toxins from the outside. So the shorter the telomeres, meaning the shorter the caps that we have, the shorter the lifespan, faster the aging, and more diseases. And
Mm.
there is an enzyme that extends this telomere, the tip of those chromosomes. It's called telomerase. This regenerates these telomeres and makes them longer, thus longer life, less disease, and more anti-aging. Here's a pretty good fun fact for you. Evidence has been seen in lobsters that they don't have any illness until, of course, they get eaten for a meal by men or by humans. And clams, like trees, they also have those stripes on their shells that shows their age. And they can reach as far as 500 years old. Even humpback whales, they reach 150 years old. And this was for the reason that they found dated harpoons in the bellies of these humpback whales. Another one is the turtle or tortoise. And Charles Darwin has a pet and actually has just recently died and reached 180 years old. And
Wow.
some fish and some birds, so all these animals actually has what we call a more potent telomerase activity, and this is a proof that species with undetectable aging and very high functioning telomerase plays a big role in preventing accelerated aging.
Okay, so telomerase, is there a way that we can enhance this activity? It sounds like we want to. Is there a way that we can enhance it naturally?
There is, Steve. The thing here is, again, going back to shorter telomeres, it equals disease, cancer, hypertension, heart disease, immune and autoimmune conditions. You name it, it's there. It's all related to shorter telomeres. Currently, we use a blood test to test it in our patients in terms of how long your telomeres are, and it actually measures your biological age. So it's not your chronological age, which you celebrate every year of your birthday, which is 41, 42, but again, this is a good assessment of the internal age and our organs, how our system is functioning. And we always do this or recheck our patients. So we do one baseline and we do an intervention, and we look at this maybe after 6 months to a year to assess how that intervention lowered down the biological age. So the key here is to control inflammation and oxidative stress to make sure that telomerase is maintained and not degraded. All healthy activities such as exercising, meditation, yoga, avoiding smoking, alcohol, drugs, even maintaining proper weight, lower stress, healthy diet. These are things that would enhance your natural telomerase activity. In our clinic, we focus on detoxification via IV therapies and acupuncture and even biofeedback therapy and even supplementation.
Okay, so is there supplements or treatments? You just named a few for telomerase that you do in the clinic that can help this activity? Like I said, supplements or maybe IVs, or you named acupuncture, or tell us about that.
Right. So the number one supplement to enhance telomerase activity, Steve, is the plant called Astragalus membranaceus. And this is a major medicinal herb commonly used in traditional Chinese medicine to treat a wide variety of diseases, and also marketed as a life-prolonging extract for humans to use, specifically in China. It's actually had been discovered for more than 2,000 years. So making you think, how come these Chinese people are looking younger than anybody else, right? But the major components of the astragalus would be polysaccharides, flavonoids, and saponins, which are all natural anti-aging components of plants. And owing to the dramatic increase in average life expectancy and the family planning program of the 1970s to 1990s, China is rapidly becoming an aging society. So the investigation of health span extending drugs became more urgent, meaning they use astragalus for that. And pharmacological research indicates that the extract can increase telomerase activity. It also has antioxidant, anti-inflammatory, immune regulatory, anti-cancer, lowering blood cholesterol, lowering blood sugars, cleaning the liver, and even a diuretic effect. These are all associated significantly to age reversal. And this will be seen in the improvement of the immune system, lifespan extension, and vascular aging. And the thing here is, this is actually ran through medical and clinical trials. So there is proof. You can Google this in PubMed, or even just Google it out. You'll see that it has been clinically proven. And we use in the clinic a very special brand of astragalus that actually has been tested. Even I myself, I'm on it just because of the evidence being that heavy and prominent. But focusing on other supplements also, omega-3s. So minimum dose would be 1.4 grams EPA, 1 gram DHA, also enhances telomerase. Antioxidants that we give through IVs and oral supplements, vitamin A, take 10,000 international units a day, vitamin C, 1,000 milligrams, 2 to 3 times a day, and vitamin E, 200 milligrams at night. Our favorite, vitamin D, that also is a potent telomerase enhancer, 5 to 10,000 international units a day, just to reach your blood levels to 60 to 100 milligrams, nanograms per mil. You will see that on a blood test requested by your doctor.
Wow, that first supplement unit, I have that. I take some of that, so just
right.
didn't know why I was taking it. I do. All right, well, great information as always. We thank you, doctor. This is Dr. Nario, Biointegrative Health Center. Check them out online, Biointegrative Health Center. And we thank you, doctor, for all this great information that you bring us.
Well, thank you, Steve. And as we all know, the knowledge is power. And thank you for letting me provide with the edge in longevity and health maintenance, which I call the biological edge or the bio edge. Thank you, Steve.